Good morning. I'm happy to see all of you turn out here. I was, discussing this with my colleagues, saying I'm not so sure I would run to an 8:30 presentation on Parvovirus, but thank you all for showing up. I want to sort of preface my comments by saying that, Parvo is one of those diseases that was particularly challenging for me, because when I graduated from Cornell back in 1977, and I went to work to the shelter, I thought, this is going to kind of be a low-stress job. After the grueling education at Cornell, I don't want to go into private practice. I feel like I really can't charge people money for guessing at what's wrong with their animals. That just doesn't feel right to me. So I'll go to the shelter where there'll be less pressure. And shortly after I arrived there, came in one morning and there was a dog dead in the cage, and with bloody diarrhea, and I'm thinking, let's see, hookworm disease or traumatic gastroenteritis, what are the things that cause bloody diarrhea? And in an adult dog, I wouldn't expect to see hookworm disease cause sudden death in what was an apparently healthy animal the day before. But we thought that was sort of just an unusual occurrence. And then it seemed like every day after that, we were seeing more and more dogs dead of bloody diarrhea. And I'm like, this is not the low-stress job I thought it was going to be. What the heck is going on here? And talking to other veterinarians in the community who were also starting to see this, and we very quickly realized that this was something new that we weren't familiar with. And so it was sort of first reported around 78, 79. We were seeing lots of dogs dying, lots of dogs getting sick. We started getting more and more reports of this sort of being spread around the world. And so there was this intense effort to try and figure out what this was. And when they discovered it was a parvovirus, they said, but hey, that's parvovirus causes panleukopenia in cats, which is cat distemper. And so we had a vaccine for cats against parvo. So everybody started vaccinating with the cat vaccine. And we don't know whether it was doing any good or not, but at least we felt we were doing something. But shortly after that, they did develop a canine vaccine, and so the spread was slowed. But even 30 years later, parvo still is a killer of dogs. Typically, it's more deadly to puppies. Unvaccinated puppies, they're at the highest risk, but any dog that hasn't been vaccinated is susceptible to it. And it is one of the most common causes of an infectious diarrhea in dogs. It's highly contagious, and it's very easily spread, which is why it's such a deadly disease in shelters. And one of the other things we see is that Rottweilers, Dobermans, Labradors, and Pit Bulls seem to be at higher risk, even when they're vaccinated. And we haven't found any genetic predisposition for that. We don't have any strong data that supports why that's the case, but certainly that's what we see. So we recognize that, particularly in shelters, when we get in Pit Bulls, Rottweilers, Dobermans, we may alter our vaccination protocol to try to get them added protection. And as I said, there's a canine strain of parvo, and there's the feline strain. And we used to think that those strains were distinct and that you didn't see the canine strain infecting cats. But now we know that there have been several strains of parvovirus, and some, at least for example, the 2B strain does cause disease symptoms in cats. And that sort of affects how we used to look at isolation and quarantining and moving animals through the shelter. We thought, well, we've got an outbreak of parvo, and sort of the caging for dogs and cats was the same. So at that point in time, we take the dogs and put them in the cat ward, and take the cats and put them in the dog ward, and soon found out that that didn't work. That's one of the things about being in a shelter, is that we try some things and we have to learn not to beat ourselves up when we find out that they really don't work. But parvo is an unenveloped, double-stranded DNA virus. The original 2 strain evolved into a 2A, B, and C strain. So there are some variations in the incubation periods and how they show up clinically, but at least the control and treatment measures seem to work for all of those strains. And the virus targets rapidly dividing cells. And again, the biggest problem we have with parvo is that it's so extremely difficult to kill. And I'll talk a little bit about some of the disinfectant disparities we have and claims about what works and doesn't work. And the other problem is that it's not only difficult to kill, it can live in the environment for a year or more. And so we used to think, well, we'll just evacuate this ward, leave it empty for, a couple of weeks, and then we'll move the animals back in. Excuse me, and we recognize that doesn't work. So the virus is primarily spread through feces and vomit, and through direct contact, and through aerosolization of fecal material during kennel cleaning. So if you're seeing kennel staff that are using high-pressure hosing, and I've seen this happen so often where they're cleaning, and there's a drain in the cage, and so they take the hose, and it's like a game that they play, trying to get the feces to go down into the drain. And we're saying that's definitely something that you want to make sure staff is not doing, because that's just going to enable more spread of the virus. And then we have the problem of environmental contamination. So if the dog's got the virus particles on his feet, and you're walking him from one ward to another, he can be actually tracking that virus through the building. So keeping animals in the same cage, excuse me, is one of the control measures that we strongly recommend, and recognizing that when we talk about fomite spread, that's the most common method that it's going to be spread in a shelter, and those are inanimate objects and our hands that are going to be contaminated with virus. So the most common fomites that we talk about are hands and clothing, but recognize that it can be anything that has contact with infected material. And there have been studies about, and you've probably seen this, where they've looked at stethoscopes and doctors in hospitals and the ties that they're wearing and how they found contamination on those. And you see where in hospitals now there's such a attention to people wearing gloves between each patient that they're handling, and that's one of the things that we recommend in terms of control measures with a virus like Parvo. The incubation period on this disease, or the period from contact with the virus to the appearance of symptoms, can be anywhere from 3 to 14 days. Now, the textbooks are going to tell you 4 to 6 days. Some of them will tell you 3 to 7. There are ranges all over. But for all intents and purposes in the shelter, we look at the outside ranges, so we're going to go 3 to 14 days. There is no true carrier state of the disease, but what we need to be concerned about is that this virus can be shed 2 to 3 days before you even have an idea that the animal is sick. And the other problem on the other end of the spectrum is that it can be shed for at least 2 weeks after the animal is clinically cured. So it's one of those disparities that I had when I was running the practice for the ASPCA. When I was working in the shelter, I was very aware of all of this information. So I knew that if I had a puppy that I had treated, because we had a hospital, we would treat them and put them back, and I was aware that I had to wait 2 weeks before I could reintroduce that puppy into the population, even though it seemed clinically cured. When I'm wearing my private practice hat, I'm treating the animal as an individual. I'm not really thinking about population medicine. And it was a while before it occurred to me to tell people after we had treated and cured their puppies for Parvo not to take that puppy to the dog park, or be very careful to scoop the feces when they were walking that animal. I would always talk to them about the animal that they had at home. Do you have other puppies at home? Make sure they're vaccinated, so on and so forth. I really wasn't thinking about environmental contamination outside of that person's own yard or their own personal space. So we really have to be aware of the incubation and shedding when we're working with populations of animals, and it's very important when we talk about diagnosis, treatment, isolation, quarantine, everything about the disease. It's important in terms of control to understand the pathogenesis and the shedding periods. So what does it do? Essentially, it destroys the lining of the intestines. It wipes out the bone marrow. We see initially, you'll see an increase in white cells as the body tries to fight off the infection, but the hallmark of the disease is really a decrease in the white cells and an inability of the animal's body to fight off any infection. With very young puppies, we see heart problems and myocarditis, and we can see sudden death in the young puppies. We sometimes see intussusceptions where the intestines will telescope in and out, and so it becomes a really dire, very serious problem. Or we may see sometimes a DIC or bleeding disorder, so it's pretty deadly virus. The symptoms usually appear 4 to 6 days after exposure, but remember what I said, in shelters we've had some at least anecdotal information that we feel very confident is true, that it's sometimes taken 14 days for the clinical signs to show. We see vomiting. Typically what I would see when I was running the clinic was people, it was almost always Rottweilers and Dobermans. And I would know when people would bring the dog in, the first thing they'd say to me was, the dog's been poisoned because it passed bloody stool. And it can be that sudden. One day the dog seems fine. The next day you may just see an animal that's depressed, that's not eating, that's weak, that's very lethargic. Sometimes they run a fever. Sometimes, depending on the course of the disease, you may not find fever. They're dehydrated. And again, you may just see sudden death in very young puppies. And I understand you don't get panleukopenia or distemper in cats here. You don't see it at all or not very often. And certainly if you get sudden death in cats, that's the first thing we think is panleuk. It's got to be parvo. So when we talk about diagnosing it, well, the first thing we look at is the history and the symptoms. And it's very important to put that all in context, because I know some shelters think, well, you know, in order to get a handle on parvo, we should just screen every animal before it comes in. You know, but that can be very misleading and very costly. You're going to get false positives and you're going to get false negatives. So you really want to look at the history of that animal. Is there a history of exposure? How's the animal acting? You know, what's going on in terms of symptoms? Do you have anything to really point you in the direction of at least a suspicion that it might be parvo? How many of you are using the ELISA in-house test? Okay, that's something that you can use that will give you pretty quick results about it. One of the drawbacks, and this is one of the controversies about diagnostics, is that the Parvo in-house test looks for the virus in fecal material. You may see a mild positive result when you vaccinate the animal, and that's what we're all telling folks to do, is vaccinate on intake. So now you've vaccinated the entire population, you suspect parvo, you do the parvo test, and sometimes the test does not distinguish natural virus from vaccine virus. Now, the vaccine manufacturer is going to tell you that's very rare. Again, we have some data, some information that says you may see a very mild positive result within 3 to 14 days of vaccinating with a modified live vaccine. I think that's just one of the things that we have to live with. But again, if you've really got parvo, you should really see a strong positive color change. And in addition to that, if you're still sort of on the fence, you're not sure about the test, you can do a blood count, look for panleukopenia or sort of a wipeout of all of the white cells. It may just be that the neutrophils have been wiped out. Or if it's very early in the disease when the body's trying to fight it off, you're going to see an increase in the white blood cell count or leukocytosis. This is the Parvo SNAP test. You do get false negatives, and that's because of the variable shedding. So if you think about what we're saying, the animal's going to shed within 3 days of being exposed. Okay, and so if you do the test then, you'll probably catch the antigen. But if the dog's body is trying to mount a response, he's going to create antibodies, and they're going to bind with that antigen. So at that point in time, you may not get shedding in the feces, and the test is going to show you a negative result, although the dog really has it. And then later on in the course of the disease, when the body gets overwhelmed and you have more antigen than you have antibody, you're going to get a positive again, which is one of the reasons why we're saying that testing is going to be very variable in terms of you just trying to screen everybody. You're going to be getting some misleading results. We do sometimes see a false positive, but that's very uncommon, and the manufacturer sort of attributes that. They sort of vacillate back and forth between saying you get false positives and you don't. But if you've recently vaccinated the animal, you might get a false positive. So again, it's a rare weak positive 3 to 14 days after vaccination. But typically, if you do this test and you get a positive and you've got clinical signs, then you've got parvo. For the SNAP test, we're using the IDEX. Not in the States, or the IDEX is the one that's most commonly used. Okay, I'm not that familiar with the products here, so you can use polymerase chain reaction testing, PCR, But that's also going to react to the vaccine strain of the virus, and that's more expensive and more costly. For all intents and purposes, in the shelter, it's going to be best to use the SNAP test in terms of the cost and efficiency and being able to get the results back quickly. Histopathology is the gold standard for diagnosis. If you have animals that are dying, you can submit samples of the intestines for the histopathology, or just do a classic necropsy if you have staff that feel comfortable and qualified to do that. And what you're going to be looking for is what we call segmental enteritis. And this is a photo from Green's infectious disease textbook, which is sort of our Bible that we all use. Of course, we're not using the shelter medicine textbooks, but yeah, this is what you're going to be looking for. How many of you are dealing with parvo in your shelters? Is this, I mean, I think we always have to be vigilant against it, but we've got some shelters that can't seem to shake it, and other shelters that just get an occasional case. How many of you are treating in your shelters for parvo? No, treating. You've got a confirmed case and you've decided that you're going to hospitalize and treat it. And can I ask, what is your success rate with that? Sorry, it's quite high. Yeah, so that's what we want to say, is that it's not necessarily a death sentence, but you've got to do treatment and it's got to be aggressive. And you need to consider very, very carefully whether or not you can do it in-house, because it does require intensive nursing care. You do need to use personal protective equipment. These animals have to be in a strict isolation area with strict sanitation protocols. This is not something that you want to track through your building, and you're not only jeopardizing the lives of the animals that are currently residing there, because it's so hard to kill and can be on everything. You can be jeopardizing future, animals that are coming in. So we recommend that unless you have a hospital where you can really initiate all of these protocols, it's best to get these animals off-site if you're going to treat them. And it requires very intense supportive care. If you've got a very low white blood count, that's been associated with a lower survival rate. These animals need to be on IV fluids. Sometimes we need to add colloids. Sometimes we do plasma. We recommend injectable antibiotics, your penicillins, your aminoglycosides, anti-vomiting medication. Everything needs to be injectable. These animals can't keep anything down, so we're really not able to give oral medications for this. This is a painful condition, so they need to be on painkillers. In really severe cases, we're going to recommend blood transfusions. A lot of these animals are further debilitated because they've got internal parasites. So this is a judgment call. If they're really, really sick, it may not be the best course of action to give them a dewormer right away. Things like Strongid are fairly innocuous. They have a wide range of safety. You might want to try that, but recognize that it really is a judgment call on that. And then we talk about trying to get some nourishment into these guys using nasoesophageal tubes and nasogastric tubes and so on and so forth. So I don't really spend a lot of time talking about treatment because I think that's pretty standardized in terms of whether you're working in a shelter or working in a veterinary hospital, however you're going to do it. It's what works best for you. And I found that in our hospital at the ASPCA, we had a very high survival rate on parvo because we stuck with the animals. A lot of times with private practitioners, people have a budget limit. And once they reach that budget limit, they've got like $400, and you're going into, some of those dogs will do really well in 48 hours, and some of them need to be hospitalized for a week. A lot of times people couldn't afford that. So the private practitioners would say that their survival rate was only about 50%, because people would pull the plug on the animals. And yet in the shelter, because we were committed and we were doing fundraising, we just stuck with them. And so some of those animals took a week to come around, and we were there to see that happen, whereas for the privately owned animals, a lot of times they didn't get the opportunity to get the full course of treatment. With sanitation, this is key. You've got to either kill the virus with the right disinfectant or mechanically remove it. As I said before, it's impossible for you to say, well, we're going to take all the dogs out of that ward and just wait a week, wait a month, because it can last in the environment for up to a year. So you've got to really carefully clean, and you've really got to carefully disinfect, not just the area that those animals are in, unfortunately, but it's really about disinfecting everything. So it's mechanical removal of fecal material that's visible. You've got to make sure that you've selected and prepared the disinfectant according to manufacturer's directions. A lot of times we see in shelters where people think, well, if I'm using bleach and I dilute it 1:32, you really can't see it, you can't smell it. I mean, you can't smell it, so it's probably not doing the job. And I know in our shelter, I used to walk in the wards and I'd be blinded by it. And I couldn't figure out how the staff could stand it, much less the animals, but they just felt, you know what, if 1:32 is great, guess what, 1:2 is really gonna do the job. You know, so we really gotta get in there and see what they're doing. With all your disinfectants, you have to look at what's the contact time, and you know, for bleach, for example, it's 10 minutes. And that's where a lot of times we fall short, is that we don't give it the full 10 minutes. You know, you're busy, there's a lot of stuff going on in the shelter, maybe some staff called in sick, and you take that shortcut, and you really haven't done the job. And that's why it's so important that you do both steps, because if you don't leave the disinfectant on for 10 minutes, maybe you at least cleaned so effectively that you mechanically removed it. Again, if the disinfectant says it has to be rinsed, it should be rinsed thoroughly. Some of these disinfectants are very caustic. You know, bleach, for example, we've had cases with kittens where they've gotten ulcers in their eyes and in their mouth because it drips down from maybe the cage above them, and you know how cats are grooming themselves and licking themselves. So you want to rinse it, dry the area, and store it as in accordance with the manufacturer's directions. So here's a list of the disinfectants that we feel confident are going to kill parvo. Okay, high on the list is sodium hypochlorite or bleach because it's cheap and it's readily available. It does have some drawbacks. It has no activity in organic material, which is why cleaning is so important before you apply it. It has no detergent, you know, properties, so and it is caustic, but it works. Trifectant or Virkon, which is potassium peroxide monosulfate, we know is a very good disinfectant that kills parvo. And I talked about this a couple of days ago, Acel, which is an accelerated hydrogen peroxide product, which is fairly new to me. The ASPCA did a trial run with it for about 3 months, and they've decided to switch over from the trifectant to the Acel. It's extremely safe. You can use it to bathe animals. You don't have to wear protective garments with it. It comes as a foam. It can be used in a variety of different ways, so we're kind of excited about that. Wizzy Wash and Brew Clean are hypochlorite type products. Don't know as much about them, but the evidence is that they do work. Prolonged high heat, we used to have this awful machine called the Steam Jenny, and everybody used to run when you'd see it coming, and they'd bring it down the hallways, and you'd have to clear out all of the animals out of the wards. You'd have to let it sit for over 30 minutes, and we didn't have any real good evidence that it worked when we were using it, but we've got better evidence now that it can be an adjunctive method for disinfecting. And again, repeated mechanical cleaning and drying. This is where we get into the controversy, the quaternary ammonium products. Now, we've got at least 4 university studies that tell us that these products do not reliably or effectively kill parvo. The quat manufacturers will tell you that it does. And so those of us in the sheltering community are saying when we see independent corroborative studies that show that, we would be happy to make that change. But as long as there's a doubt in our minds and we don't feel comfortable saying, go ahead and use a quat. And certainly if a product is called Parvosol, you're going to think it's going to kill parvo. You know, but I would not take that chance. I say to any shelter, if you're using a quaternary ammonium product and you're not having any problems with it, that's fine. But if I had a parvo outbreak, if I had a calicivirus outbreak, I would certainly switch over to one of the other products. Alcohol doesn't work. So if you're using hand sanitizers, and when we talk about sanitation in general, we talk about hand washing and wearing gloves. In some cases, the hand sanitizers help, but not with parvo. It's just not going to kill the virus. And then Nolvasan, time and freezing. These are all things that have been tried, and we are confident in saying this doesn't work. In terms of management, we recommend keeping dogs in the same runs for the duration of their stay. And so often we're talking about fast tracking and reducing length of stay and so on and so forth. And certainly we have a habit of moving at animals that come in and they're in intake, and then they go into the stray ward. They may end up in a quarantine situation, so on and so forth. But we really want to minimize moving animals around as much as we can, not only for disease control, but for stress reduction. We've talked before about how every time you change an animal's environment, you stress that animal. And stress is one of the things that you want to minimize if you're dealing with parvo. You want to clean your areas that have puppies in them first, then you go to adoptions, and you progress through the shelter so that the last area that's being cleaned is where you have your sick dogs. And sometimes that formula gets lost in the shuffle when the shelter is overcrowded, or when you don't have enough staff come in, people are on vacation, they're out sick, so on and so forth. But it's little things like this that can contribute to something like parvo getting a foothold and spreading through your shelter. We like to see animals in double-sided runs so that they just move back and forth. A lot of times what shelters do when they're cleaning the dog runs is you take the dog out of the run and he gets to run around in that central area. And that's his exercise period, that's his socialization period, and that's also his opportunity to spread disease. And that would mean that if you do that, every time you put that dog in that common area and put him back in his cage, you need to clean and sanitize that area. And what did we say? Bleach takes 10 minutes. So we really, if you can just move the animal from one side of the run to the other, that's going to be a much better system for you. If you are going to tie the animal to the front of its cage so that it doesn't have access to other animals, we have a system where we have a row of cages and there'll be one empty cage at the end, and we move the animals down. So there's the empty cage here. I clean this cage and move the animal down into that adjacent cage. And that at least minimizes your exposure rather than this random shifting animals around while we're cleaning. And you want to use separate cleaning equipment in each room. You don't want to be dragging the mop and bucket down the corridor and going into each set of runs. Unfortunately, we do recommend that you not place puppies on grass because they are our most vulnerable patients. And we know that grass is incredibly difficult, if not impossible, to do anything with in terms of disinfecting, other than to just remove it. I'm just reiterating again that our recommendations that come from most of the shelter, vet experts that I know is use Virkon, Excel, or bleach diluted 1:32 if you're dealing with parvo. And use shoe covers instead of foot baths. At one point, probably 3 years ago, we were very high on foot baths. We've had some studies that indicate that not only are they not effective in preventing bacterial spread or viral spread from one area to another, they may actually contribute to it, because if you're stepping in the foot bath and there's contaminated material in there, there's fecal material that we've already indicated that disinfectants can't penetrate, and now you're just walking down and you're spreading it. So it's better to have dedicated shoes or boots outside of the ward that you're cleaning in, or using shoe covers. I think back to some of my other presentations and say, can I go back and pull that foot bath slide that was in there like 5 years ago? Because at the time, that was the current thought. But what the great thing about shelter medicine is that we need to be able to keep up with the latest data and make those changes. I've talked about avoiding mops and buckets and high-pressure hosing. With laundry, there's a lot of questions about, well, how can we effectively disinfect our clothing? If it's really heavily soiled with parvo, I would say try to discard it. But if not, when you launder it, it's just go ahead, use hot water, use a good detergent, and put a cup of bleach in with the laundry. Don't overstuff the laundry, and use a commercial dryer, because that's going to give you some added disinfectant opportunities. If you just hang it on the line to dry it, and I just recently visited a shelter where that's what they do to save the cost of the electricity for running the dryer and so on and so forth. And that might work during ordinary times, but if you've got a parvo outbreak, you don't want to do that. If you've got carpeting, then I would say rather than use bleach, try the Acel or the potassium peroxide monosulfate. But you know what we say about carpeting in animal areas? That's a no-no. Okay, but you may have carpeting in the front office or in other spaces, and if you've got staff that are walking back and forth, they've come from a ward where you've now discovered you had parvo, and guess what? They had walked into the front office. Now you've got carpet that's contaminated and has to be disinfected. So essentially the best thing to say is what needs cleaning? Everything. What do we typically forget to clean? Doorknobs. Isn't that how we get colds? We always think, the cold is you're coughing and sneezing on people, and they keep telling us, it's your hands. The doorknobs, the drains, and so on and so forth, the clothing, these often get overlooked, and we sort of prefer using the disposable cardboard carriers that you send animals home with. rather than using these, because they need to just be dipped and immersed in a big vat of disinfectant. If you can't do that, you can use the squirt bottles, and that's just very labor intensive. In this particular situation, you see there's a separate, little shovel here and the squeegee. You've got the dedicated boots. They actually have a foot bath here. They're prepared. Washing hands, again, I advise you all to go to the CDC website. I was stunned at the amount of information they had there about washing hands and what the best products are to use, and how you really have to make sure that you wet your hands with warm water, that you make sure that you get the soap under your nails and in between your fingers, and that you do it for, I think they recommend going through the alphabet, but making sure it's 20 seconds, rinsing and drying your hands. Most of us don't take that much time to do it. So you're really, it's not effective if you're not going to do it properly. And the other thing is to use gloves. And this is I'd never seen this before. I've been to shelters where they say they don't have a sink in the room. So this is a portable sink unit. So, that's also my recommendation. There should be a sink in every animal, room, but some shelters can't do that. They've retrofitted. They're in an emergency situation. So you can't get the portable sink system. In terms of prevention, key, vaccinate all dogs on intake with a modified live high titer Parvo vaccine. Isolate dogs immediately who show signs of infection. All the sanitation we've talked about, avoiding overcrowding, minimizing stress. The vaccine that we recommend, this is like the core vaccine protocol for shelters, is a distemper adenovirus 2 Parvo parainfluenza vaccine at intake, given to every dog over the age of 4 weeks, given even if they're sick. If they're too sick to be vaccinated, they're probably too sick to be in your shelter. Okay. Repeating the booster is ideal. Typically with an adult, we say if it's over 5 months or over 4 months, it doesn't need a booster till a year later. But if you're in a shelter situation where you've got a higher risk of exposure, then you may want to do it in the adults in 2 weeks, and for puppies every 2 weeks until they're 18 to 20 weeks of age. That's a little bit at variance with what the private practitioners are doing, and if they get wind of this and they think that, those shelter vets, boy, they're just quacks. They don't know what they're doing. Tell them that we've got good recommendations for this vaccination protocol. When you've got an outbreak, don't panic. You need to do a risk assessment. Can the environment be disinfected? Are you disinfecting all of the areas, hallways, vehicles, play areas? What is your cleaning protocol? Look very closely at that. Don't ask the staff what they're doing, see what they're doing. My first experience with Parvo, I knew they were using bleach, and I would ask them, because we just couldn't seem to break the outbreak. And I said, and we were scrubbing everything, and I finally went in and I watched, and we had these rubber mats that had these slits between them, and they were scrubbing the top of the mat. They weren't taking the mats out and scrubbing the bottom of the cage and scrubbing in between those slits. And when I lifted the slit, all this organic fecal material was still caked there. So yes, when I asked them, are you cleaning the cage? Are you cleaning everything? They said yes, but they said, well, you didn't ask us about the mats. So go see what they're doing. If there's crowding in the shelter, that's going to work against you. If animals are doubled up in cages, or if you've got double-sided cages, the whole point is to have one side empty. Shelters get crowded, they put animals on either side, so you've defeated the purpose. How many cases are you dealing with? Look at the individual animal. Is it vaccinated? What age is the animal? What was the exposure like? Is it a litter mate exposure? Just because one animal in the litter has Parvo and is very, very sick doesn't mean that they're all going to get as sick. But obviously, those are at much higher risk. How long were they exposed? Was it an animal that just walked through the hallway, or was it an animal that was sitting in a cage for 2 or 3 days with another animal? So we have to take all of this into consideration. And then we do a risk evaluation. So we do a Parvo snap test for the very high-risk animals. And that would be our litter mates that are closely exposed. If it's a widespread outbreak, then we want to do the snap test on all of the animals. On the animals that have no clinical signs, we can do an antibiotic titer test, which is still a little bit controversial, But what we want to do is see if those animals have protection, whether they came in with protection or whether they've got vaccine protection. We want to do a titer test to see what's going on. And you want to wear, this is just an example of full body protection that we can get from a hardware store, a painting suit. And if you really got an outbreak, and yeah, it can get costly if you've got to have a suit per animal, but at least for the high-risk animals that are going to be your puppies. The titer test is about $10 to $30 per test. That's in the States. I don't know what it would be here. You may think that that's cost prohibitive, but again, if you restrict it to at least the animals that you've identified as being high risk, that have been exposed, that are under 5 months of age, you may be able to contain some of your costs. Now, the manufacturer says if you run it correctly, it's going to be about 98% accurate in detecting who's got antibody protection and who doesn't. The positive result is good. If I get a positive result, that means that the animal's got some type of antibody protection, but that makes the animal at low risk, but that's not no risk. And if you get no protection, that doesn't necessarily mean the animal is doomed. Okay, but again, we're trying to do this risk assessment to figure out how we're going to manage the outbreak. So this is sort of a breakdown of what we're looking for. If the animal has clinical signs, you don't need to test it. For all animals, that's a high-risk animal. If the animal doesn't have any clinical signs, and you do the titer test, and it's negative, okay, that animal has no protection, and if it's under 5 months of age, that animal's at high risk. Again, no clinical signs, and you do the test, and the titer result is positive, and it's under 5 months. It's low risk, but we have an asterisk there because you may be getting a positive titer test result from the maternal antibodies. And we know that those are going to fade out in a period of time. So they're constantly declining. It's still some risk, but if we're assigning sort of a category for it, it would be lower. And the ones that we like are the ones that have no clinical signs. You do the titer test, it's positive, it's an adult animal, it's going to have protection, and that's a low-risk animal. So we need to look at placing animals in isolation as soon as we suspect that they're sick. We need to make decisions. If we're not going to treat them and if we don't have isolation, then we need to remove the animal. And whether that means getting it into a foster care situation where they're willing to treat the animal, or that means getting it into a hospital, whatever options we have available to us. If we're not treating and if we can't isolate, we need to remove the animal. 14-day quarantine to cover the incubation period. If you're putting animals in quarantine, if you're looking at puppies, if it's been 14 days since the last vaccination, vaccinate them again. Okay, vaccinate your adults, give them a bath, because remember, this virus can persist on the animal's fur coat. And so even after that animal's clinically cured, and say we've waited 14 days for the shedding to end, if there's viral particles on that animal's fur, then that animal can remain infectious for quite a long period of time. So we want to give these animals a bath. If you've got litters, we can at least keep them in pairs, again, for stress reduction, and adults should be housed separately. So we've kind of, I know this is sort of repetitious, but if you've got quarantine and isolation, limit your access. This is not an area you want the public walking through unless they're escorted. If it's open access and they get to go everywhere to look for a lost animal, escort them, but make sure that it's really limited to just those people that have to be there, separate supplies, protective clothing. And I just want to conclude by saying this is a vaccine-preventable disease. It's like the deadly scourge of shelters. Oh my God, we've got Parvo. I've seen where shelters have totally depopulated their canine population, and that's certainly what we did in the early days when I first was dealing with Parvo. Anything that was in the same room, because we didn't know all that we know now, everybody got euthanized. Today, we can take these steps, vaccinate on intake, isolate our sick animals immediately, always practice good sanitation, not just when there's an outbreak, but all the time. Avoid our overcrowding. Recognize that if you have the resources, you can use diagnostic and titer testing. And sometimes we get companies to donate the test. If you tell them you've got a shelter and you're trying to save these animals' lives, a lot of times the companies will come through and they will donate the testing kits. The universities will work with you. There's a lot of goodwill dealing with this. and recognize that good planning can help reduce your losses. So I thought if I had an extra, do I have like a minute left? Let me just this just recently came from Colorado State University. You're holding up the zero. Now, do I? Okay. So that's why I put this after the conclusion, because I have a history of going over time. But this is a recent study that came out of Colorado State, which was looking, can we treat these animals effectively with home treatment? Because so many people cannot afford the $1,000 plus that it costs to treat a parvo puppy. And they used 40 dogs, and they had the dogs that were the control that went through routine inpatient hospitalization, and the ones that got the home treatment. And they got an 85% survival rate with the home treatment compared to a 90% survival rate with hospitalized patients. Now, this is sort of a preliminary study. The two drugs that they were using were moripetant, which is an anti-nausea medication that you can give under the skin once a day, and then Convenia, which is the antibiotic given under the skin once, and that lasts for 2 weeks. And then they were doing sub-Q fluids under the skin 3 times a day. And they got pretty good results there. So I think that, for the person who cannot afford hospitalization, that might be able to come up with a couple of $100s to treat, if the option is the animal either dies or has to be euthanized, this might be something to consider. Okay, and I've given you the reference if you want to look it up. I've basically given you as much information about this new protocol as I have, and that's what you guys have. I don't have any more to tell you about that. Okay, thank you.